Summit 2020 pre-summit on COVID, post-COVID-19 and SDGs positives. Malawi, like many countries, is a signatory to the UN Sustainable Development Goals. We know that all the 17 SDGs are interlinked, and it is hard to achieve one without the necessary improvements in many others. Please allow me, however, to zero in on SDGs 3 and 6, which as a Deputy Health Minister are of immediate concern, and more so in the light of COVID-19. SDG 3 challenges us to ensure healthy lives and promote well-being for all at all ages, while SDG 6 urges us to ensure availability and sustainable management of water and sanitation for all. Well-being is broad and measured in so many dimensions. As would be expected, Malawi is doing well in some dimensions and not so well in others. We have sustained consistent decline in infant, child, and neonatal mortality, drastically reduced deaths due to HIV, and attained the 90-90-90 HIV targets ahead of schedule, and reduced malaria and TB deaths, among key milestones. Life expectancy has consequently improved, being estimated at 63 years for both males and females. On the other hand, the burden of non-communicable diseases is increasing, and there are still significant health system bottlenecks to deliver universal health coverage. For SDG 6, one of the targets is to achieve universal and equitable access to safe and affordable drinking water for all by 2030. In Malawi, 87% of households use an improved source of drinking water. Only 8% of households, however, have piped water into their dwelling, yard, or plot. Talking about COVID-19, distinguished ladies and gentlemen, Malawi has been affected just like so many other countries. We registered the first confirmed COVID-19 case on 2 April 2020. Meanwhile, a state of national disaster had already been declared by the former president before we had a case. This entailed closure of schools, closure of borders, restrictions on gatherings, and other personal preventative measures. We believe this helped to keep the cases low. However, cases began to rise when there was a lapse in managing infected returnees from abroad, which led to increased local transmission. The national COVID-19 response met with challenges, including limited testing capacity at the beginning and inadequate personnel protective equipment, PPEs, due to disruption to the global supply chain system and excess global demand, among others. On the other hand, COVID-19 provided an opportunity for investing in health systems holistically. More health workers were recruited across different careers. Diagnostic capacity was strengthened, and treatment facilities were bolstered. Distinguished ladies and gentlemen, as you may know, the impact of COVID-19 has not only been its disease burden and mortality, and anecdotally, we understand that utilization of other essential health services has gone down. This could be due to, first, an adjustment period during which the healthcare system was working out how to continue provision of essential services in the midst of the pandemic, and when there was a lot of emerging and rapidly changing evidence which ended to be adequately understood by policymakers to make sure that right decisions were taken. Second, citizens have been urged not to visit health facilities unnecessarily, while some citizens have been cautious of visiting health facilities nevertheless. Third, health worker capacity has diminished due to infected health workers who have had to go on quarantine. And fourth, financial resources have been reallocated away from other essential health services to the COVID-19 response. It is also likely that mortality due to non-COVID-19 causes has increased because of the reduced utilization of healthcare. This we are yet to ascertain. School closure due to COVID-19 will, in the long term, cost the country in terms of reduced future productivity. In the short term, however, teenage may escalate. COVID-19 has also impacted the economy. Industry has contracted. People have lost jobs. Many small and medium enterprises have gone under, and tax revenues have consequently declined. COVID-19 therefore affects not only SDGs 3 and 6, but also many other ones, and risks dampening the momentum that countries, including ourselves, have had towards SDG attainment. As I conclude, I would like to point out issues that we need to consider as we either adapt to living with COVID-19 or recover from the effects of COVID when we finally overcome. First, we need to strengthen the capacity of all countries, particularly developing countries, for early warning, risk reduction, and management of national and global health risks. Second, health allocations should be prioritized in national budgets. In Africa, low-income countries, in order to build resilient health systems that can effectively contribute to global health security. Third, the One Health approach is more relevant than ever and needs strengthening. Fourth, African countries should join hands in research and development of COVID vaccines so that we are not passive recipients of vaccine allocation. Decisions made by vaccine allocation decisions made by the North. Fifth, economic stimulus programs will be imperative in order to give economies the necessary impetus. For Malawi, foreign capital injections at very concessional rates may be indispensable. Given our high domestic debt levels, sixth, we'll have no strength. Our social protection programs, we'll have to strengthen our social protection programs so that it can reach more people. Seventh, there will be need for multilateral and AMP bilateral lenders to consider granting a moratorium on debt servicing and possibly debt cancellation until the economy returns to pre-COVID-19 levels. Seventh, investing in local manufacturing of PPEs and other medical products should be a priority for LMICs, given the challenges we've faced from the global supply chain issues due to the COVID-19 pandemic. Distinguished ladies and gentlemen, I'll finish by stating that overcoming global health risks such as COVID-19 requires stronger international cooperation. Whether COVID-19 will be with us for a while or will go away, there are actions that should be taken either way to make sure that we do not derail our momentum towards all the SDGs. I come to the conclusion of my statement. Thank you very much for giving me the floor.
Thank you very much, Honorable Minister for Health. Um, I'm amazed at how much ground you've covered and the strength of your recommendations. And before Pauline picks up, I just want Pauline and the rest of us to please just take a moment to recall that not only has the Honorable Minister for Health told us about SDG and 3 and 6, she's also told us about the adjustments that the health sector has had to put into place in order to address COVID-19, but also to address other health conditions to reduce excess mortality. And then she has talked to us very comprehensively about a raft of recommendations that address, in total, global health security. But she's gone through early warning, pandemic preparedness, resilient health systems, the One Health approach, the vaccine initiative, economic stimulus, social protection, multi and bilateral lending, debt cancellation, local capacity to manufacture, and then she has ended with the overcoming global health risks. I want to now ask Pauline to kindly let us know what the questions are that we want to pose to Honorable Chrissie before she steps down from the platform. Pauline, over to you.
Pauline, you need to unmute. Pauline, unmute, Pauline. Dr. Pauline, unmute.
Right, I've unmuted. Okay. Thank you very much, Honorable Chrissie. You have quite a few questions rolling in, actually. Yona says, thanks, Honorable Deputy Minister. Congratulations on your recent appointment. We must congratulate you for that. He's keen to know the new government's master plan in tackling COVID-19. We hear about Malawians in South Africa adversely affected by COVID-19 and many returning home very sick or in coffins. So what is Malawi government doing to address this immediate problem? That's Yona Matemba asking. Over to Honorable Chrissie.
Yes. Actually, I think the master plan is that we're having as a Ministry of Health or as a government. It's to try our best to reduce local transmissions, like more restrictions on mass gatherings. The government is trying to acquire masks for majority of the masses. We are going to quarantine most of our returnees. As you know, most Malawians, they go to South Africa to work. So we have lots of them coming back because of COVID over there and unemployment. So they come back to Malawi and we get local transmissions. That's why our numbers have been going higher. So the government is putting in place quarantine centers so that everybody is tested at the border. If they are negative, they'll be quarantined to make sure that maybe after a week or two, they're tested again. If they have COVID, then they can be taken and get administered for COVID medication. I think that's what